Oh, that's good to know. It's looking better in Red Lodge. All right, I will wait till exactly 2 o'clock to get started, just to give people a couple more seconds to trickle in if they need to. Okay, that is 2 o'clock. So, hi everyone. My name is Marilyn Bennett, and I am the Outreach and Digital Resources Librarian for the Montana State Library. And as part of my duties for that, I manage the Montana Talking Book Library, which is a library that is for the blind, low vision, or anyone who has a physical or reading disability, anyone who's not able to read regular print. And so our speaker today, her name is Emily Shuman, and I will introduce her now by reading her bio. Emily Shuman leads the Rocky Mountain ADA Center, overseeing strategy, operations, and a six-state service region. Since joining the center in 2018, she's become a trusted consultant on the Americans with Disabilities Act, known for her clear, compelling education on complex ADA issues. Drawing on her lived experience with non-apparent disabilities, Emily brings both insight and leadership to the national accessibility landscape. So please join me in welcoming Emily.
All right. Well, thank you very much, Marilyn. I will get my screen shared here quickly and we will jump into it. Okay, so looks like everybody's seeing what they're supposed to be seeing. So
Yep, perfect.
um, we'll just jump in. Once again, my name's Emily. I'm the director over here at the Rocky Mountain ADA Center, and glad to be with you all today to talk about how the ADA, the Americans with Disabilities Act, applies in your library settings. So this is otherwise known as Title II of the ADA, and we'll explain all about what that means here shortly. I do have to start with a bit of a disclaimer, which is just a reminder that the information that you're getting today should not be considered formal legal advice, but rather just informal guidance. The Rocky Mountain ADA Center is operated by the University of Northern Colorado, which is in Greeley, Colorado. And we're funded under a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research. And we're charged with providing technical assistance, training, materials, and we also conduct research. And our service region is all of Colorado, all of Utah, Montana, North Dakota, South Dakota, and Wyoming. So that's our region. We are part of the ADA National Network. So this consists of 10 regions. You can see how the regions are broken down. Um, really what I want you to all to make sure that you understand and take away from this slide here is just that if whenever you have a question about the ADA, you have access to free and confidential technical assistance through the ADA National Network in your regional center, which of course is the Rocky Mountain ADA Center, our center. So whenever those questions come up, give us a call or shoot us an email. We have information specialists on hand who can answer those questions. We do a variety of other things as well, including training and research, like I mentioned. But just remember that, should you be confused or have more questions following today's presentation, our information specialists and myself are always, available to help you and provide that guidance and support. Okay, so getting right into it, of course, we have to define, the Americans with Disabilities Act, right? What is it? So if you're not familiar, the Americans with Disabilities Act is a civil rights law that was signed into law July 26, 1990 by President George H.W. Bush. And it really, again, as a civil rights law, exists as a guarantee of equal opportunity in areas of public life for people with disabilities. So it's meant to correct the historical wall of exclusion that people with disabilities had faced up until this point. So that's why President George H.W. Bush is quoted as saying, "Let the shameful wall of exclusion finally come tumbling down." And that was his declaration as he was signing the law. So generally, the overarching promise of the ADA is that it prohibits discrimination on the basis of disability. And we'll talk a lot more about what different types of discrimination can look like. Um, so before we can go on, of course, we have to understand, what does it mean to be disabled, right? What is the definition of disability? The ADA uses a specific legal definition of disability rather than a medical definition. And this is the only eligibility criteria that people have to meet in order to access the protections offered by the ADA. So the ADA defines disability as a physical or mental impairment that substantially limits one or more major life activities. So you can see this is by design very broad. So it's meant to be fairly easy for you to qualify as a person with a disability if you have any sort of health condition. This can also be things that impact your organ systems. This can include things related to mental health. There's no exhaustive list of disabilities. The only qualification standard, again, is does your physical or mental condition or impairment substantially limit a major life activity? And major life activities are things like seeing, breathing, eating, sleeping, walking, working, and the list goes on and on. So if it's something that the general population can do with little or no difficulty, but it's difficult for you, that would be considered a substantial limitation to a major life activity. So again, it's meant to be easy for people to access these protections. We're not putting people through rigorous testing or requiring that people meet a high bar to access protections under the ADA. The ADA also has these additional prongs around the definition of disability, where if you have a record of having a disability or if you're regarded as having a disability, you're also protected by the ADA. So a record of a disability might be just something like, I used to have cancer, I got treatment for that, and now that's in remission, but now I have a record of an impairment. Right. Being regarded as having impairment means that you might, because of the way you look or, something that affects the way you interact with people, maybe people perceive you as being disabled, but you're not actually disabled in any way. But the thing that actually disables you is other people's attitudes and opinions and misconceptions about you. So a real world example of this, there was a recent lawsuit that was filed by someone in an employment setting who was perfectly capable of doing his job as an assembler, but he was fired because somebody noticed that he walked with a limp. And even though he wasn't disabled from doing anything, he was regarded as having that disability. So that's just an example of when you might be protected under that regarded as standard under the ADA. So we're going to talk a lot about the letter of the law, so all of the ins and outs and what's required by the ADA throughout this presentation. But I think it's also important to just acknowledge the spirit of the law, which is just, that the ADA, wants to make sure that everybody gets what they need in order to fully participate in society. So that's known as equity, which is slightly different from equality, which is where everyone just gets the exact same treatment. So we're going for equity, which is a little bit of a higher standard, meaning that we do take into account people's individual circumstances and barriers and conditions, and what they individually need in order to make sure that they have that equal access to participate. So you can see kind of how that difference is illustrated there on this slide. Again, the ADA is not an affirmative action program or an entitlement program. It's just about leveling the playing field. We always talk about, making sure that people have equal opportunity, but that doesn't necessarily guarantee equal results. So not everybody's going to be guaranteed the same experience, and, sort of like your mileage may vary, right? Like as long as we all have an equal opportunity, we all have the same options, but we're all going to have different results. Okay, so let's talk about the prevalence of disability in Montana specifically. This data comes from the Centers for Disease Control and Prevention, the CDC. So it's estimated that about 28.7% of Montanans have a disability, or excuse me, of adults in Montana have a disability. So that's about just over 250,000 adults in Montana. So that's now well over 1 in 4 people, right? That's starting to approach 1 in 3 people. That percentage there, and you can see this is further broken down into different categories of disability: mobility disabilities, cognition disabilities, hearing disabilities, and seeing disabilities. Those are all different categories of disabilities that people might experience. There's also disabilities that impact people's ability to care for themselves or live independently. And of course, we know some disabilities are obvious, but the vast majority of disabilities are not apparent just by looking at someone or, interacting with them. So important to think about, why should we care about the ADA, just kind of beyond that it's required and we want to be in compliance, right? There's a few important factors to consider here as well. First of all, a disability is an identity that any one of us can gain at any time or acquire, right? We use this language of acquiring a disability. Most of the time, it's not about if it will happen, but when and how. Many of us are going to have at least some sort of temporary disability. Maybe we have an accident or an illness. Some of those things might be permanent. And all of us are going to experience a change of ability as we age, especially the longer that we're fortunate enough to age, the more of those age-related disabilities that we might be experiencing. So disability is something that is likely to impact every single one of us in some way or another throughout the course of our lifetime. So if you think of it that way, we talk about people with disabilities making up the largest minority group in the country and in the world. We talked about those prevalence numbers. So, that nearly 1 in 3 people with a disability or adults with disability in Montana. But a lot of us in the disability field believe that those reported numbers might actually be lower than the reality. Sometimes people don't see themselves as disabled or they don't identify as having a disability. So when those studies rely on people self-reporting that they have a disability, well, if I don't see myself that way, even though I've got some medical condition that limits a major life activity, right? Maybe I meet that standard, but I simply don't identify as disabled. So sometimes there's some conflict in just the identification or awareness of somebody having a disability. Sometimes people choose to keep their disability status private, or sometimes they just don't know. Maybe they're not well, but they don't have access to medical care, so they don't get a chance to get diagnosed and really understand what's going on with them. Accessibility is also really important for community engagement, right? So accessibility allows people to participate in civic life, in recreation, in work, and more, right? So it's really critical to leading to a sense of belonging in the community. If you were trying to access a library service that clearly, hadn't been thought about in the way that library service was designed or implemented, you're going to quickly start to feel like, you know what, I don't think I belong here. This is not the right community for me. So making sure that things are accessible really helps people with disabilities feel like they belong. And that sense of belonging is critical to kind of an overall life satisfaction. And of course, accessibility benefits everyone. So this is not a surprise, right? People, we've all experienced the convenience of having to, use the push button to open a door when our hands are full, right? Or pushing our luggage up a wheelchair ramp for convenience, or if you're pushing a stroller, something like that. having a ramp in place is beneficial. And this extends to all kinds of areas, things like Bluetooth and even smartphones. These are technologies that every single one of us is using, but were developed originally for the disability community, for people with disabilities to have access. So we find that, this is critical, accessibility is critical for people with disabilities, but it ends up enhancing the lives of everyone and benefiting everyone. Okay, so the ADA is divided into 5 titles. That's what they're formerly called. You can also think of these as chapters. So really, each chapter of the ADA outlines which area it applies to. So Title 1 or Chapter 1 has to do with the responsibilities of employers with employees with disabilities. Title 2, which is the one that we're focusing on today, has to do with state and local government entities, right? So you're the state library system or a public library, you're going to fall into this state and local government category. And then we have Title 3, which is businesses or places of public accommodation. So, that would be things like your hotels, banks, coffee shop, movie theater, really any private or business, either for profit or nonprofit, is going to fall under Title 3. Titles 4 and 5 are a little bit, sort of less referenced. The Title 4 has to do with telecommunications. So this is why, we see closed captioning on TV. This is what makes it so that deaf people can text 911 if they're in an emergency situation. So a few other things that come out of that title or chapter. And then Title 5 is miscellaneous, which, really lives up to its name. It's just kind of a bunch of random stuff in there about how the ADA is enforced and how it interacts with other laws and different things like that. So just important to know that anytime you need to if you're looking this up later and you need to know like what is the library supposed to do in this situation, what is our requirement here? You could look up Title II ADA requirement for blank. So just having that Title II language is important for things that you might want to reference in the future. Okay, so we know that barriers can take many forms, right? So people with disabilities experience different types of barriers. Many of us, what first comes to mind is things like physical obstacles, like, when there's stairs without ramps available, could be an example of a physical obstacle. Communication barriers, like lack of sign language interpreters, or attitudinal barriers that stem from things like misconceptions or stereotypes about people with disabilities. And then, of course, we have rigid requirements or lack of flexibility. And I'll say, flexibility is probably one of the biggest things that any one of us can do to make life easier for people with disabilities and to comply with the ADA. Just being able to do things a little bit differently than we normally do them when that would be helpful for a person with a disability really goes a long way. Okay, so let's dig a little deeper into our Title II or government responsibilities, right? So Title II applies to all state and local governments, their departments and their agencies. This is also, this category is also otherwise known as public entities. So this could be a state agency, town, city, county, any of those are kind of in that public entity category. Like all parts of the ADA, Title II prohibits discrimination against qualified people with disabilities in all programs, activities, and services that you offer. And that does include facilities. Title II also has some standards around operation of public transit systems. I don't think that's super applicable to the library system. And Title II, important to note, is enforced by the United States Department of Justice. So if a patron decided that they thought they had been discriminated against, they could file a complaint with that enforcing agency, and the agency could investigate and does have some law enforcement authority. People can also sue in private lawsuits as well in federal court, but most people take advantage of that enforcement mechanism before they get into a private lawsuit. one thing about the ADA is that it's enforced reactively, right? So there's no ADA police, and code enforcement does not look at or enforce the ADA. So if a person experiences discrimination, then at that point they have to file that complaint and trigger that enforcement mechanism. So it's a reactive enforcement system. Okay, so let's look at some general responsibilities under Title II. So, again, very, very high level, as with all parts of the ADA, you have to ensure equal opportunity to participate in goods and services for people with disabilities, all of those services, activities, and goods that you offer. Sometimes, in order to do that, you have to make reasonable modifications to your policies, practices, or procedures. And we're going to talk more about that. We also have to provide effective communication, meaning that we have to make sure our communication with people with disabilities is as effective as it is to people without disabilities. And sometimes we have to provide auxiliary aids and services in order to accomplish that. And again, we're going to talk more about that as well. And then, of course, accessible facilities, right? So nothing else can be accessible if a person can't get in, and get around our facility. So that is a critical component and responsibility and requirement under the ADA. So under Title II, this is specific to public entities, to those government entities. Every public entity with 50 or more employees has to designate at least one employee as its ADA coordinator. And this person is designated to coordinate its efforts to comply with the ADA and carry out all of those responsibilities. So most of the time, the ADA doesn't give a lot of real detailed specifications about this. So most of the time, an entity will designate somebody as an ADA coordinator on top of their other duties, right? So it would be like, you're already the facilities manager, so we're also going to give you the ADA coordinator responsibility. Sometimes it falls on someone in HR or someone in risk. Different kind of departments end up being being responsible for the ADA coordinator duties. So there's a lot we could talk about for ADA coordinators, right? But a couple of things that they must do is to facilitate completion of what's called a self-evaluation and transition plan. They have to publish public notice, and they have to establish a grievance procedure. It's really important that your entity make the name, address, and phone number of your ADA coordinator available to anybody who needs that information. So most entities will have it, somewhere on their website. If you need ADA assistance, here's the name and contact of our ADA coordinator. So I talked about that public notice. So this is required. It's just a statement or a policy that you put on your, put out to the public, typically again on your website, which talks about your efforts to comply with the ADA and helps people understand what their rights are. So it should include statements about ADA compliance and employment, people's right to effective communication, how they can request modifications to policies and procedures, how they can request those auxiliary aids and services for effective communication, how they can file those complaints with your organization, what your ADA coordinator's contact information is. So all of that should be available within your public notice. We did link a sample public notice on this slide. So in case you don't already have one, you'll have access to an example. And again, always helpful when you can put this information in multiple places, right? Like understanding that people with disabilities don't always have access to, to a website. So maybe they need to see it printed in the paper or, on a bulletin board in a community center. So putting this in various places is really helpful for access. So that grievance procedure, again, this is required if you have 50 or more employees. And this is, just what it sounds like. This creates a clear process for a person to submit a grievance or a complaint if they feel that they've been discriminated against and didn't have access to your facilities or services. So again, we've linked a sample grievance procedure here, but it really just describes how somebody can file a complaint, and what the process for reviewing and resolving that will be. Um, so that's definitely required and is typically something that your ADA coordinator will facilitate making sure that's put in place. Okay, so we talked about sometimes you have to make reasonable modifications to your policies and procedures. So again, a reasonable modification is just any change that you might make to a policy, practice, or procedure that allows somebody to have that equal access and equal opportunity. So I'm going to give you some examples, but first I want to mention that there are some what we call defenses. So this is like when somebody asks for something that's not reasonable. There's a couple of categories of defenses that are available. So fundamental alteration, this is like when somebody asks for something that would fundamentally alter the very nature of what it is that we do. Um, so if we're a library and somebody asks for us to rent a car to them, for example, well, we rent out books where we loan out books, but we don't loan out cars. That fundamentally alters the nature. That request fundamentally alters the nature of what a library exists for. So that would be considered unreasonable. Undue burden is a category where somebody asks for something that's way too expensive or way too difficult, and we're not able to provide that. And then, of course, direct threat, that one's pretty straightforward. If somebody asks for something, a modification that would create a threat to that person or to other people, we do not have to provide it. And public entities are also not required to provide people with personal services and devices. So we don't have to take people to the restroom. We don't have to watch over their service animals. We don't have to provide wheelchairs or glasses. In some cases, we can go above and beyond, right? If we want to, we can have a wheelchair, on hand for somebody who might need that, but that's not a requirement under the ADA. So important to note that with reasonable modifications, there are limits. We do, reasonable, that word reasonable is really key here. So people have to ask for things that are reasonable for us to provide. So some examples of what this might look like is, if somebody wants to come to the library with their service animal, and we typically don't allow animals into our libraries, we have to allow that. We have to make that modification to our no pets policy or our no animals policy in order to allow someone to come with their service animal. If we typically ask for proof of identification, maybe to sign up for a library card, and we want people to show us their driver's licenses. Well, a driver's license, might not be accessible to everybody with a disability. Some people might just have state IDs because they don't drive. So we might have to have a process where we can allow for a different type of identification. We want to make sure that we're modifying something like a no outside food or drink policy for someone who maybe has a dietary need or maybe has an allergy or diabetes, something like that, that requires them to have food or drink on hand. So this is just a couple of examples. Again, reasonable modifications usually come up by request. We're typically not expected to be, thinking about what people might need ahead of time or trying to anticipate everybody's needs, right? And reasonable modifications can be formal modifications that we make where we, make a clear modification to a written policy, but sometimes these can be informal as well, right? So imagine you have a metal detector when people come in the library that someone has to go through, but a person in a wheelchair, their wheelchair is going to set off that metal detector. So maybe we just very quickly off the cuff informally make a modification to our security policy where we, pat someone down or we check with a hand wand or whatever maybe we've determined is appropriate in that circumstance. So again, we don't always have to like go back to our written policies and actually modify those policies. We just have to be aware that sometimes we have to do things a little bit differently for people with disabilities. That's the bottom line. Okay, so I want to take a moment to talk a little bit about service animals. I'm sure you've got questions, so I'm going to hopefully share some good information. And again, we're going to have time for questions at the end. So important that we understand the definition of a service animal, right? This is any dog or miniature horse that has been individually trained to do work or perform tasks for the benefit of a person with a disability. This can apply to someone who has any type of disability, and the dog or miniature horse can be trained to do any task that mitigates that disability. There are also no breed restrictions when it comes to service dogs. So a person can have a service pit bull, a service Malinois, a service Chow, any sort of breed that can be trained to help mitigate their disability. So the service animal handler has the rights. The animal itself does not have rights, but the service animal handler has the rights. So the first thing that we have to provide, of course, is the right to public access. So if someone has a service animal, we have to allow them to gain access to anywhere the general public can normally go. And we have to allow them to do that in an integrated setting. So we can't ask them to, sit outside or stay in the basement or, if otherwise segregate people. They have to be allowed to integrate with everybody else. Sometimes it is appropriate to have multiple service animals, especially if you're someone who has, different service animals who do different tasks, or you have one service animal that's getting ready to retire and one service animal that you're training new. So then you might have some overlap there. We can't charge any surcharges, and this is applicable across the board, not just when it comes to service animals. We cannot charge people with disabilities surcharges, even though ADA compliance might create some additional cost for us. So in the context of service animals, we can't just say, we're going to have to charge you a pet deposit to bring your animal in here, or a fee, an extra library fee because you bring a service animal with you. We are not allowed to do those things. However, if you have a standard damages policy that applies to everybody, those with and without disabilities, you can charge someone for damages that their animal causes. So big question that comes up a lot is, what if someone else is afraid of dogs, or what if somebody else in the library has an allergy, right? Well, generally speaking, those are not valid reasons to exclude the service animal handler. The only exception to that would be if the other person's fear or allergy was so significant that that rose to the level of disability, right? And then you're dealing with two different people with disabilities. So you would have to find a way to accommodate both in that situation, maybe scheduling them at different times to come in, or helping them, stay located far away from each other. That would be a case-by-case determination. But generally speaking, fears and allergies are not a valid reason to exclude a person with their service animal. Okay, so how do we know if it's a service animal when somebody brings an animal in, right? Can we ask for registration, proof of disability? Should we be looking for a harness or vest that the animal has on, some sort of certification or paperwork, ID card, patches, documentation, proof of training? So the answer is no, none of that is legitimized under the ADA. The only thing that legitimizes a service animal is what we call credible verbal assurance, and then actual witness behaviors. And so those are the things that we're looking for and attending to when it comes to service animals. So with credible verbal assurance, there are two questions that we're allowed to ask someone if they're bringing in an animal and it's not immediately obvious that that's their service animal. We could say, is this your service animal required because of a disability? You could abbreviate this and just say, is that a service animal? Um, so some variation of, is this a service animal required because of a disability? Yes or no, right? That's just a yes or no question. And then the second question is, what work or task has the animal been trained to perform? So remember that training is the key differentiator between a pet, an emotional support animal, and a legitimate service animal. So what you're listening for here is something that is a verb, not a passive action, right? So this is something that the animal would have had to receive training in order to know how to do. So there's all kinds of things that animals can be trained to do on behalf of people with disabilities, right? So you see those listed here: retrieving items, mobility tasks, alert tasks, rescue tasks, grounding, perimeter checking, self-care assistance, guiding, covering tasks. So you'd want to be listening. I mean, this is not an exhaustive list, but it gives you an idea of the variety of things that service animals can legitimately be trained to do. Again, the bottom line is to ask yourself, is this a task that this animal needed training in order to know how to do for this person? And then once you get past credible verbal assurance, so the person has answered those questions sufficiently, from there you have the behavioral expectations that you can look to. So wherever there's rights, there's also responsibilities, right? So the people with the disabilities also have some responsibilities. Service animals have to be housebroken, and they always have to be under their handler's control. Typically, that means that they will be on a leash or tethered in some way, unless the person's disability prevents them, the person from using or like holding a leash or a tether, or being on a tether interferes with the animal's tasks. But no matter whether or not the animal's on a leash, it always has to be on the handler's, under the handler's control. Um, so if it's not on a leash, the handler has to be able to control it with their voice or other signals, any other way that they might control it. There's no required or forbidden equipment. So, you might see service animals often with vests that identify them as service animals, but just be aware that that's not required. That's just entirely the handler's preference. Um, Service animals do have to meet local safety requirements when it comes to licensing, vaccination, and registration. So whatever is required typically of animals in your jurisdiction is also required of service animals. So then it stands to reason that if animals are disruptive or out of control, if they're causing damages, if they're not housebroken, if they're really, having issues staying under control or being disruptive, then you can ask someone to take their animal and remove it. Right. Important though that this is based on actual witnessed behavior, not just fears or generalizations or assumptions. And also important that we continue to offer our goods and services to the person without their animal present. So we don't kick out the person. We just ask them to, remove the animal from the premises because it's not under control or it's being disruptive. Okay, so the next question we often get is, what about emotional support animals, right? So emotional support and therapy animals, while, I believe are genuinely helpful and useful for some people, they are not trained to do specific tasks for people's disabilities. So because they're not trained in any way and they don't perform tasks, they do not meet the definition of service animal and therefore are not required to have public access with their handler. So if somebody has identified their animal as a service animal, or as an emotional support animal or a therapy animal, we might need to get some clarification from them and make sure that this animal has actually received training. But if it's truly just emotional support or comfort, we do not have to permit them access with that animal. Okay, so program access, we're going back to just our general Title II responsibilities here. So, program access basically states that public entities cannot exclude people from participation just because your buildings are inaccessible. But it also doesn't necessarily require that you make every element of every single building fully accessible. So, for example, you can achieve program access or program accessibility, if inside your library you have 4 bathrooms and 2 of those bathrooms are accessible. So when viewed in its entirety, that library facility is accessible and those programs are accessible, right? So, you could look at that in a variety of different ways. If your municipality has 5 different library branches and 3 of those are accessible, then your library services can be seen as accessible when viewed in their entirety. So we don't have to necessarily make facilities accessible, especially, those older facilities, have different standards. But when you look at all of your library offerings in their entirety, they all have to come together to be accessible. So when do we have to make facilities accessible? So we have to comply with the 2010 ADA standards for accessible design anytime we're newly constructing a facility or anytime we're altering an existing facility. So these standards set the minimum requirements for facilities to be accessible to and usable by people with disabilities. And even though they look very much like a building code, they do not serve as a building code, but rather as a physical representation of civil rights. So again, I mentioned that if a person can't get to the facility, can't get inside it or around it, that is a form, that would be a barrier to access, right? That would be a form of discrimination because the person, isn't able to access the building, and they don't feel that sense of belonging, and they don't feel welcomed there, and they can't access the services that are happening in that building. So I'm not going to get too deeply into this. Again, any one of these concepts we could do a whole full hour on, but just important to note that anytime a new building is being built, or anytime we're altering or making renovations, we have to make sure that our designs and our construction is compliant with the ADA standards. So just a note about older buildings. So older buildings do have to follow the standards. So a common misconception about the standards is that buildings that predate the ADA or historical buildings are not covered. But this is just simply not true. They do have to follow the building standards. We do, however, have what's called the safe harbor provision, which is where basically we had an earlier version of building standards, the 1991 standards. And so if your building was built in compliance with the 1991 standards, you do not need to go in and then change them to or update that building to comply with the 2010 standards until the point at which you're doing those alterations or updates or remodeling. So again, this is just a way of acknowledging, like, hey, we already tried to comply by meeting the 1991 standards. Now you're telling me there's a 2010 standard. And so it's a way of just kind of balancing people who already made a good faith effort, not asking them to kind of do the work twice. So that's safe harbor. But really important to know that grandfathering is not an existing concept under the ADA. So if you ever hear somebody say, "Oh, this building's really old, so we're grandfathered in," that's not a thing. That's not real. So there's always going to be some requirement for building accessibility, just again depending on these various factors. So like I said, there's lots more to learn about buildings. This is just a resource slide with some links if you want to learn more, if you're particularly interested in buildings. But for now, we'll turn to effective communication. So again, remember, this is where we've got to make sure that people who have communication disabilities are communicated with as effectively as people without disabilities. And, we have those same exceptions around fundamental alteration and undue burden. So again, undue burden is significant difficulty or expense. Just important to note here that this is a really narrow exception or defense, especially for public entities, for those Title II entities. Um, because the enforcing agency expects you to take into account all of the resources available to you, not just the money in your bank account, right? So they would look at, do you have real estate? Do you have any other sort of assets or holdings that could be tapped into? This undue burden, it's not just something's expensive. It really should be something is not only expensive, but it's extremely difficult to provide, or like borderline impossible to provide. So if you are making this determination that something that somebody has requested is an undue burden, really important that this gets documented by the head of your entity or their designee, and make sure that there's a clear rationale for, we looked into it, we hear all of the factors that we took into account, and here's ultimately how we came to this decision. So again, I talked already about fundamental alteration. Those are those changes that are so significant that they fundamentally alter the nature of the service, or program being offered. Important to note that if you do use one of these defenses, you still have to work with the person who's made that request to try to find something that does work for them. So it doesn't completely relieve you of your obligation to just say, oh, that's a fundamental alteration. My work here is done, right? Then you have to continue working with that person to try to find a way to include them. So again, I mentioned the use of auxiliary aids or services. Again, this is when we provide these things, this is almost always in response to someone's request. We don't typically have to provide these things proactively, unless we want to go above and beyond the ADA, which we certainly can do. But examples of auxiliary aids and services are things like large print, braille, sign language interpreters. If we're, offering, spoken public speaking events, or even if we're just meeting with someone one-on-one, we can have sign language interpreters for people who might need that. Audio recordings, printed information when we normally provide it, verbally, assistive listening systems, open or closed captioning on video materials, video relay services, which helps us communicate over the phone with people who have hearing disabilities, screen readers. So these are just some real common examples of auxiliary aids and services that are out there. But again, this is not an exhaustive list. So Title II does require you to give primary consideration to what the person specifically asked for. So if somebody lets you know, hey, I really need to have a sign language interpreter, be available for this meeting that we're having, you're supposed to provide what they asked for, as often or as much as you feasibly can before you suggest like, oh, we can't do a sign language interpreter, but we could write notes back and forth, or we could text. You could offer something different that's equally effective, but again, the ADA requires that you give primary consideration. So as much as possible, you provide people with the exact thing that they ask for. And again, public entities are required to pay for and provide these services and auxiliary aids. And again, we have that same no surcharge provision where we can't pass on these costs or expect people with disabilities to pay for these accommodations. So effective communication requirements also extend to companions whenever it's appropriate. So for example, perhaps you have a child who's in a volunteer program at the library, and you are in a situation where you need to communicate with their parent, but the parent has is deaf, for example. So even though the child or the teenager, let's say, is the one who's patronizing the establishment and accessing the volunteer service, if you would routinely communicate with the parent in that situation, and the parent has a disability, in that case, you would have to provide effective communication with the parent as well. Hopefully, I'm making sense. um, so whenever companions become involved, you have to provide effective communication for a person's companion as well. So again, that could be family members, or it could be friends or associates. So, the example I have on slide here is family members or companions with disabilities who come to court proceedings, doctor's appointments, or school meetings. So again, if it's normally appropriate for people to have companions with them, we have to provide effective communication for the companions as well. So a big question here often is, do I have to have these types of auxiliary aids and services available at all times? Again, the answer is no. Typically, the ADA is reactive, so reactive to those requests. But, it's certainly good if you can have some auxiliary aids and services available. We always say good access is good business, but often we don't know what people need until they specifically request things or let us know. So the best practice that we can employ here is to make sure that we've provided clear, conspicuous information about how people can request auxiliary aids and services. And if we want to go above and beyond, we can think about what are some things that we could just normally put in place that would be beneficial for everyone. So maybe we always have captioning on our videos from now on. We just do that standard, right? Whether or not people request it. Or maybe we just know that we have a sign language vendor on hand that we can call pretty quickly if somebody needs access to sign language. We always encourage people to go above and beyond what the ADA strictly requires. We say the ADA is kind of like the floor, not the ceiling, or like getting a D in the class, right? Sometimes we just want to do D for done, but sometimes we want to do a little bit better than that. So again, just sharing some resources with you where to find. We often get a lot of questions about, well, where do I find these providers? And how do I put all this stuff in place? So lots of resources here: Registry of Interpreters for the Deaf, CART services, your local ADA center. Of course, the Rocky Mountain ADA Center can often point you in the right direction. Your local independent living center or other disability group could be helpful. So ask your library network. Sometimes you might have someone in your network who's worked with one of these auxiliary aids and services and can give you some suggestion or point you into a resource. Okay, just a few more things to say here before we break for questions. So digital communication. So of course we have lots of communication that's happening in digital spaces, right? On websites, in mobile applications, just emailing back and forth or sending documents. So we do have some new rules under the ADA and as well as other disability rights laws. So a new rule under the ADA, under Title II of the ADA, requires a specific enforceable standard for website accessibility, the Web Content Accessibility Guidelines. Actually, just breaking news, just as of this week, the deadline for compliance with this new rule has been extended by a year. So many entities were coming up on a compliance deadline this week or next week, but now we've got another year to comply with this. So if you're somebody who's working with digital products or in the digital space for your library a lot, I really encourage you to get more information about the new rule for web accessibility. And we also have something very similar for Section 504 of the Rehabilitation Act, which applies to you if you receive any federal funding. I believe the compliance deadline is coming right up for this one. I haven't heard of any extensions, but again, I wouldn't be surprised if the compliance deadline gets extended here as well. But either way, this is really critical and important for providing access and effective communication to people. So again, just the bottom line that I like to share with people is that, get familiar with these web content accessibility guidelines, as they are now required by several laws. And in some places, even state laws have begun requiring this compliance with this standard for public entities or local governments. Okay, so this is where I start to wrap up. I just want to give you some best practices. Again, totally up to you if you want to go above and beyond the ADA, but here are some things that we see routinely makes organizations be successful when they are put in place. So things like staff training. So you guys are experiencing that now, just understanding ADA rights and responsibilities. You can look at training around disability etiquette and respectful interactions with people with disabilities. There's training available for if you want to understand more about what assistive devices and technology are there for people with disabilities. We could do a whole more in-depth training about service animals if that's, something that's a hot topic for you. Also helpful to have clear internal accessibility policies that your staff is trained on and aware of, right? So everybody knows, who do we go to? Who do we talk to? How do we make things work when we get these requests from people with disabilities? Something like a disability employee resource group is really effective on helping ensure inclusion of people with disabilities. And those people, your employees with disabilities, can really help identify gaps and areas of improvement. And that's great representation as well. So speaking of representation, helpful to engage people with disabilities in meaningful ways, right? Integrate people with disabilities as contributors to and participants in your library program, services, and resources. And we always recommend employing people with disabilities at all levels of the organization, right? It's really hard to make a culture shift if we are not, if we don't have good representation within our organization of that culture. And of course, there are countless authors with disabilities, right? So if you're wanting to get some more depth with people with disabilities in the library space, invite an author with a disability to do a reading or a book signing or something of that nature. Community outreach and engagement. This is another really good practice. So you can, put something in place like an access advisory committee, where you have a group of volunteers who helps you evaluate and provide suggestions on your programs and services. Again, really helpful to have that perspective from end users or from the public on what we're lacking or what we could be doing better. Creating both formal and informal partnerships with disability organizations, parents of disabled children, other government offices and schools. Again, really just deepening, our exposure to people with disabilities and integrating with people with disabilities. Emulating the successful practices of others. So if you see a library that seems to be doing this really well, I highly recommend, copying what they do. That's we lift each other up, right? We can really challenge each other to be more successful. So emulate those good practices. Network within your industry and see who else is passionate about this work and is wanting to do it really well. And then when you can get a group of people together who all have that same sort of passion, often that's when you can start to make things happen. And then make your commitment to inclusion externally visible, right? So this, put some information on your website, celebrate some disability awareness weeks or months, put some stuff out there on your social media. Again, often people with disabilities are looking for some indication that they're welcome, that they've been considered, and that they belong. So the last thing I'll recommend is providing or soliciting feedback for continuous improvement, right? So can you find opportunities to get a survey, to put a survey in place? so that people can provide feedback on what's working, what's not working, what they'd like to see. And can you make that survey available in different methods? Can we have an opportunity for someone to fill out a paper survey while they're physically in our building? And can we also follow up with a digital survey when we know somebody has recently visited the library? So finding those ways to get feedback directly from people with disabilities is always, a really good practice to have a meaningful compliance and accessibility impact. So what do people actually need, and are asking us for? So review those accessibility efforts that you are doing at regular intervals, making sure that we take time to incorporate that feedback that we've gotten, brainstorm new ideas, take into account any new technologies that have emerged, and find ways to innovate our programs and services to be more accessible. All right, so I will leave it there with my formal presentation. This is my contact information. And want to leave that up on screen for anybody who wants it, but maybe we can, I see we've gotten quite a few comments. I don't know, Marilyn, if you've been making note of some good questions or if we just want to go down the list.
I think we can just go down the list. Man, that was a great presentation. Thank you, Emily. That was a lot of good information. And like I said, we have a lot of questions in the chat. So let's scroll back on here.
Yeah, I'm seeing some logistics. Okay.
Hmm.
So first question I see here from Stu, do the public transit requirements apply to our bookmobiles? So that's really interesting question. It depends on if the bookmobiles are transporting people with disabilities, or does the bookmobile just go around and people can kind of come in while it's on location. I mean, either way, you're going to have some compliance responsibilities there. So if the bookmobile transports people with disabilities, then yes, those public transit um, uh, requirements would come into play. But if it's just like you park it and people climb in and get a chance to look at what books you have on the shelves in the bookmobile, you still would want to find ways that you might be able to modify your practices for people with disabilities. So, maybe the gold standard would be like, can we put in a wheelchair lift that helps get somebody up into the bookmobile? If that's not something we're able to do, can we do we have some staff people who can, go down to the person in the wheelchair if needed. So finding some ways to accommodate a person in a wheelchair if they were trying to access the bookmobile. So good questions. Do you have sample public notice statements? So yes, I did link a sample public notice on one of those slides. I will make sure that Marilyn has access to the slides after today's presentation and can disseminate those. And anytime you're looking for something like that, a template or an example of something, feel free to reach out to us and we'd be happy to look up, provide you anything we know of. Request for a copy of the recording. Okay, it looks like that one's been answered in a chat message. Yes, I did a service animal presentation back in February, so I'm glad that got put in the chat. You shared your accessibility statement. That's excellent. Slides posted. Except for service animals in training in Montana, those in training do need to be vested and marked as a service animal in training. Yes, absolutely. That's a great thing to bring up. There are state laws that come into play with service animals, including laws around service animals in training. So I think I talked about that in my service animal training that I gave. Does the library staff need to provide additional assistance for children with disabilities, or is that on the parents? Okay, so that's a good question. So it can depend. We talked about the fact that the ADA doesn't require you to provide like personal services. So if it's sort of like providing direct care for someone, that wouldn't be something that necessarily is required. However, if a child with a disability came into the library and, was dyslexic, for example, and was having trouble, independently finding the book that they were looking for, or, following the Dewey Decimal System, um, to figure out, where to look for something, they could potentially ask a library staff member for assistance. And then that would be you assisting the child with the disability, right? So it just kind of depends, I guess, on what level of assistance is being requested. But you don't have to like toilet a child with a disability or supervise a child with a disability or provide those like direct care tasks. So hopefully that delineation there is a little more clear. Lloyd, so we know Lloyd and the Rocky Mountain ADA Center go way back. So Lloyd is a great resource, very knowledgeable. So I see he's in the chat there providing some answers as well. So what if a traveling exhibit provides audio description but provide no information on how to access it? Yeah, that would be a shame, wouldn't it? You're doing some really good accessibility work with audio description there, and you're not making sure that people are aware that that's available. So, in my opinion, that's a kind of an easy, that's easier to fix than the other way around, right? You already have it in place, so let's just find a way to get the word out. Can we put some information on the website, social media? Spread the word, kind of on a grassroots basis, contact maybe like the School for the Blind or somebody who might, a group that might be interested in taking advantage of that, and letting them know that that's available. Okay, so I'm wondering what the rules about providing a costly accommodation for someone that is not in your library district. I was specifically thinking of hiring someone to provide sign language. Um, I was specifically thinking of hiring someone to provide sign language when they are not your patron. Okay, so yeah, this is a little more complex. So you could look at this as a fundamental alteration if you never work with people that are outside of your library district, then that might be a fundamental alteration of the nature of what you do. But libraries are open to the public, and probably that means they're open to people who live outside of your library district. So I think personally, I would recommend erring on the side of caution with this one. And even if this person is not in your library district, offering, making that sign language interpreting happen. Um, if this is a situation that you're dealing with on a regular basis, like this person is regularly patronizing and asking for sign language interpreting, and they're not in your district, I would recommend at that point maybe contact the ADA Center, and we can talk through some alternatives and solutions, and the other things that might be available for you to consider. Um, okay, so or access ready on smartphones, or audio description ready only on smartphones. I'm not sure exactly what that's referring to. Marilyn, does that make sense to you?
I think that might refer to the question above about traveling exhibit provides audio
Ah,
descriptions, but provides no information how to access it.
oh,
Um,
gotcha,
the
gotcha. Yeah.
chat was on fire at that point, so things were just coming in.
Yeah, same answer then at that point. Yeah, let's get the word out. Those are really great things to make available for people. Do you have any advice on how to begin things like outreach from the position of a library assistant? Transparently, I don't exactly know what a library assistant does, but generally speaking, I think outreach, showing up to different types of events, like tabling events, can be really beneficial. If there's like a disability resource fair in your local area, can you have a booth there? Can you share some information? Most municipalities have like a council on people with disabilities. Um, you can reach out to like those types of entities or disability groups, like independent living center probably would love to hear from you. um, a parent center, probably would love to hear from you. Again, outreach can sometimes just take the form of posting on social media, like, hey, did you know we have great options available for people with disabilities? Here's just some of the things that we have available. So those are just some general outreach suggestions I can offer. And again, contact me if you have like a specific goal in mind, and maybe I can help you brainstorm something a little more specific. So during summer reading, I think maybe there's some chatter. I'm not understanding what that
I
means.
think maybe that was about, ooh, actually, no, that is not connected to another one. Let's
It
see.
it was
Oh,
connected to the question about if we had to provide an assistant for a child who say
got it.
their behavior caused by some kind of a disability creates too much havoc going on.
So that would be sort of like, in my opinion, that's kind of like providing a caretaking service. And that would not be required of you. If it's just something simple, like, asking a child to quiet down, perhaps maybe that's something that you have the capacity to do. But if it's like having a one-on-one kind of caretaker or assistant for a child, I don't think the library would be responsible or required to provide that.
Okay, thank you.
You're very welcome. As a field, we talk a fair amount about creating accessible spaces for patrons, but I'm curious if you have resources or advice on how to be more proactive about creating accessible spaces for staff. Oh, that's a great question. Yeah, I mean, I think that going back to flexibility, right? The thing that I see the most having the most impact on creating an accessible environment for staff is flexibility. So allowing staff to be flexible about, their hours if possible. I mean, I know it's not always possible, but if somebody needs to go have a, doctor's appointment, can they easily do that? Are there times when people could work from home if they needed to? If those things aren't available, can they have some flexibility in their workspace? So, can I bring a plant from home? Can I have a blanket nearby if I get cold? Or can I have specific lighting? Am I allowed to wear my headphones while I work? So just allowing some flexibility. And I think also having like quiet or like sensory rooms is also really something that a lot of staff benefit from. Just sort of like an area of refuge if you feel overstimulated, having a place where you can kind of go get grounded and regulate your nervous system. So that would be a great option for staff. Um, Disability etiquette, I would say, is a big thing that we can learn about that helps kind of build in a more inclusive culture around the way that we interact with people and the way that we talk to each other. Sometimes we don't realize that we're working with someone who has a disability, and we might find ourselves, making jokes about disability, or saying sort of those like offhanded comments like, oh, I'm so OCD about my desk. And we don't always realize that those kind of off the cuff, um, comments that we make could be damaging for someone, or hurtful, or at least just reinforce a stereotype, right? So great question. And those are kind of my best pieces of advice that I can think of. Um, yeah, resources for disability etiquette. So we have a couple of different versions of disability etiquette. We have online courses that are available for free. So you can find those training.rockymountainada.org. So we've got a few different versions of a disability etiquette course. We often do it as a live training like this as well. So feel free to reach out to me if that's something you're interested in. And there's lots of disability organizations that have blogs and pamphlets and tip cards and things like that. There's lots of good information out there. So, Yeah, Great Lakes ADA Center has a good one too. I think maybe that's a video. I think we have a video series. All of the ADA centers put great resources out there that are free and usually easy to access. So I think we've gotten through all the questions that were in the chat. If I somehow missed your question, um, try asking it again, or unmute yourself and chime in.
Well, I don't hear any, so I'll give it a couple more seconds for questions if they pop up. But thank you, Colette, for sharing the evaluation form. I'm going to put my information in the chat as well as a really short handout that has a couple local Montana resources that might be of use to you. And yes, please feel free to use my information too to contact me if you have situations that come up in the library that you need an extra set of ears on. I can try and help you, and I can also get you to the resources that can definitely help you. So yeah, feel free to contact me, and I will send that now. All right. I still don't hear any other questions. So thank you so much, Emily, for this. This was so informative and very interesting. And thank you, Colette, for helping things run in the background. Um, I think that's about it.
All right. Well, thank you so much, everyone, for your time and attention. And feel free to reach out after if you have questions that come up later.
Awesome. All right. Thank you all for coming.